Sup, brothers? Type-IIx here. This is the 8th episode of Gear, Growth, and Gains. Welcome. Alright, so this week we will discuss 3 topics. First topic will be a comparison between AIs, Aromasin versus Arimidex. Section number 2 will be Mast versus Primo. For both of these sections, there will be a clear winner. And the third section will be the coach's corner, discussing cues and modifications to exercises to connect with the back. Okay, so let's get into it. So section number 1, let's discuss AIs. So whereas SERM, selective estrogen receptor modulators, block ER alpha in the brain's hypothalamus and pituitary to increase LH, FSH, and testosterone, AIs are inhibitory of the aromatase reaction itself to decrease E2 and also increase LH, FSH, and T as a result. It does this by slowing the enzyme's reaction. Aromatase is present in testes, in the brain, adipose tissue, of course, and even muscle is something that people forget. Maintaining lifelong low body fat levels is a method that is reliable for decreasing circulating estrogens like estradiol. So while fat loss by caloric restriction does cause significant reductions to aromatization in absolute terms, it does not obviate or reverse it. This is because fat cell synthesis, adipogenesis, occurs readily as an evolutionary mechanism to promote surplus energy stores during famine and periods of starvation. Apoptosis, or cell death of fat cells, basically requires chemical lysing, like Kybella or deoxycholic acid, freezing, like cool sculpting, or removal, like liposuction, to fully reverse the effect of increased fat cell number and increased fat mass on estrogens via aromatase. Okay. Arimidex and anastrozole is a popular AI used in bodybuilding. I regard this as quite poorly tolerated. It's very old. It was patented first 28 years ago in 1996. Chinese patents for Aromasin, on the other hand, exemestane, issued in 2009 and in Canada in 2014. So Aromasin is a more modern drug. Arimidex is a competitive inhibitor of aromatase. It's a steroidal AI. Competitive inhibition is what many guys are familiar with. Okay, it's antagonistic binding, the active site of aromatase in this case, or any enzyme that's the target of a drug, competing with the substrate for binding. So, for example, testosterone would be a substrate. Suicide inhibition is also known as mechanism-based inhibition. Some people call it permanent inhibition. I want to be clear about what that means. So, practically, suicide inhibition means that after steady state is reached by exemestane, aromasin dosing interval and dose, an increasing aromatizable dose, for example, increasing from 500 to 1,500 milligrams weekly testosterone, will not increase E2 significantly. So to compare these two drugs, Aromasin versus Arimidex, first let me give you a summary. Okay? This will be repeated after concluding this discussion, but I will say that Aromasin is more advantageous for bodybuilders than Arimidex. Okay, so Aromasin does not decrease IGF-1 significantly. Further, its inhibition, remember, is suicide inhibitory, is not overcome by increasing AAS dose. It's also an androgen. Its primary metabolite, 17-hydroxyexemestane, is potently bone anabolic. So, quite unlike Arimidex. With Arimidex, you're dealing with bone fractures frequently. This is because it decreases bone mineral density and content and promotes bone resorption. It also is far worse for hair loss than Aromasin. With Arimidex, you prevalence of hair loss is 2.5 times greater versus no drug. And it diminishes IGF-1, which is very important for us. So I want to note as well that AIs greatly decrease E2 while on exogenous aromatizables like test, but not otherwise. It's been speculated that full suppression, total suppression to zero E2, would require orders of magnitudes greater, like grams of Aromasin, and hundreds of milligrams of Arimidex to truly abrogate or block E2. This is because testes aromatase is dense and intratesticular testosterone is robust. So with suicide inhibition, the elephant in the room is always the question, what happens when we stop Aromasin? Is aromatase permanently reduced? No. The answer is no. And this is because of the nature of metabolism and enzymatic processes. So aromatase is an enzyme. There's constant churn of metabolism. There's turnover of aromatase synthesis. So while some people may have slow drug metabolisms for this drug and may see some persistence of reduced E2 and aromatase, it's not going to be very long lasting. At most, it might be a month and a half, something like that. Okay. So I will discuss briefly the mechanisms of Aromasin's inhibition, suicide inhibition. So with suicide inhibition, they're regarded as irreversible inhibitors. They bind to aromatase, in this case, or any enzyme that is the target of a drug. Undergoing chemical transformation converts them into reactive intermediates that covalently modify the enzyme, usually at the active site, so at aromatase itself. This is distinguished from the competitive inhibition of Arimidex, which binds to the active site of an enzyme, competing with the substrate, here, testosterone, for example, for binding. So with this antagonistic mode of competitive inhibition, increasing testosterone dose will increase E2, unlike with the suicide inhibitor. Okay, so the way that it works, aromatization is a chemical process that involves 3 hydroxylation steps. Exemestane, Aromasin, binds to aromatase at residue E3O2, forming a hydrogen bond with the backbone nitrogen of 2 other residues, I-133 on aromatase's I helix strand, and F-134 of its B derivative C loop, basically preventing the loop from drifting. This is a sort of clamping mechanism that holds exemestane in the active site. Exemestane's 3-keto group, remember, it's basically an androgen, forms a hydrogen bond with residue S478. Then exemestane is converted to reactive intermediates via hydroxylation. And that's really what aromatization is, 3 hydroxylation steps via hydroxylation of the C19 group. And these intermediates irreversibly bind aromatase. Okay, so that's it for the suicide inhibition mechanism. So let's move on. Let's discuss the differences again. So I want to reiterate that, to summarize, the differences between Aromasin and Arimidex are that Aromasin is just a clearly better drug. It does not decrease IGF-1. Its inhibition is not overcome by increasing testosterone dose or aromatizable dose. It's an androgen. Its primary metabolite, 17-hydroxyexemestane, is potently bone anabolic. Arimidex, on the other hand, is associated with bone fracture and joint pain, decreases bone mineral density and content, and promotes bone resorption. And it's the worst for hair loss. Basically, when you see breast cancer patients that lose their hair, it is often because of Arimidex or combined hormone treatment, including Arimidex. Okay, so let's discuss section number 2, which will be Mast versus Primo. Again, here there will be a clear winner. All right, so Masteron is a 5-alpha androstenedione 3-on and is potently androgenic. Its high frequency of detection in strength and power sport doping samples coincides with its enhanced strength effects. Its use in breast cancer was discontinued because of its androgenizing effects in women, unlike Primo. Primo is still used for breast cancer treatment in a large part of the world, mostly the Arab world. Primo is a 1-ene. It's an attenuated androgen still manufactured and sold by Bayer as Primobolan for treatment of metastatic breast cancer in women. Mostly. Albeit indirectly, enhanced strength by Masteron increases neural drive, permitting more intensive muscular work and mechanical tension, in turn enhancing hypertrophy and progressive overload. Masteron, as well as Primo, is readily available as enanthate. However, with Masteron, you can easily hold in solution at 400 milligrams per milliliter. This is not the case for Primobolan. Primobolan, pharmaceutical Primo, comes as 100 milligrams per milliliter. It's very difficult to even hold Primo in 200 milligrams per milliliter concentration without it crashing out the solution. Okay, so Primobolan is a thick, viscous oil containing 100 milligrams per milliliter of metenolone enanthate, and it is obviously notorious for crashing, even as low as 200 milligrams per milliliter. To get above that, generally you have to use guaiacol. Guaiacol is a chemical irritant, disinfectant, and cough expectorant. It is classified as a hazardous chemical, and according to the World Health Organization, the WHO, is probably carcinogenic in humans. Both Primo and Masteron are inherently anti-estrogenic. They are 5-alpha reduced androgens, and it's common knowledge that 5-alpha reduced non-aromatizable androgens have anti-estrogenic effects directly. They inhibit aromatase directly. Masteron, further, has been demonstrated in English language research data to prevent the uptake of estrogens into tissues such as breast tissue. Masteron has been trialed as a male anti-gynecomastic agent, actually, in Japan, for which it is very effective, albeit less so than the non-methylated epistane analog epitiostenol, which we've discussed before. And that drug is still clinically used for this purpose there. I want to mention as well that there has been confusion from YouTube videos. I know that in September of 2023, in a YouTube video titled Primo versus Masteron Rematch Advanced Discussion, hosted by Dr. Todd Lee's Anabolic University, Dr. Todd Lee, MD, and Kurt Havens, PhD candidate, discussed purported effect of atamistine, a steroidal AI, being metabolite of Primobolan. I find this quite unlikely. I invite Kurt to publish this research. This is because all of the data, Schanzer's data, as well as just the full repertoire of metenolone metabolism data published so far, shows that metenolone maintains its 5-alpha core, never losing it. Now, atamistine is, and it's an interesting AI. It's basically an androgen. It's 1-methylboldium, and it's an intermediate drug between E2 and Primo. Basically, it's an andros 1,4-DN like boldenum, with a 1-methyl like Primo and a 3,17 keto like androstenedione. Interesting drug, but totally irrelevant to our discussion between Masteron and Primo. It's an AI. So it is basic androgen chemistry, an incontrovertible fact that non-aromatizable 5-alpha reduced androgens are anti-gonadotropic, suppressing TEAD and E2, and anti-estrogenic as well. Both these drugs are metabolized extensively by 3-alpha hydroxysteroid dehydrogenase. This is ubiquitous in human skeletal muscle, practically reducing its muscle anabolic effects. the two of them. With respect to a enzyme called 11-beta hydroxysteroid dehydrogenase 2, 11-beta HSD2, an enzyme that controls cortisol oxidation and that, when inhibited, leads to glucocorticoid-mediated MR activation. Basically causes potassium excretion, sodium and water retention, increasing blood pressure. Basically a bad thing. Now, we don't know about Masteron. We don't know what it does to this enzyme. But we do know that Primo does not inhibit it, which is a good thing for cardiovascular disease and renal risks. So that's a plus for Primo. So to summarize, Masteron, on the one hand, gets a check mark for strength benefits. It's a check mark for holding in solution at high concentrations, so you don't have to pin as much, right? So you can pin 400 milligrams per milliliter of Masteron. Primo, not good for strength. Not really. The Primo, it's so thick and viscous generally, especially the pharmaceutical form, that you need a tuberculin syringe to push high volumes of the stuff, really. Yeah, and you'd need guaiacol to really get above 200 milligrams per milliliter with it. Basically, a lot of disadvantages for Primo. Both are anti-estrogenic. Both are only mildly anabolic because of 3-alpha hydroxysteroid dehydrogenase metabolism. We do know one benefit basically for Primo is that it has been proven to have reduced cardiovascular disease risk because of its agnosticism towards 11-beta hydroxysteroid dehydrogenase 2. We just don't know. It's a question mark next to Masteron for that. All right, so that's it. I mean, basically, you rack up all the factors on one side and the other, and Masteron is just a better drug. All right, so let's talk about section number 3, the coach's. Okay, so I want to talk about cues and exercise modifications to connect with the back muscles during exercise. So, first of all, obviously the back is not actually a muscle. It's an anatomical region. There are major muscle groups that we are concerned with as bodybuilders. We'll go from the top down, essentially. So there's the trapezius, and the trapezius muscle is really a muscle group. It's got upper, middle, and lower fibers. There's the mid-back, the rhomboids. There's the lats, the latissimus dorsi. We think of as wings, viewed from behind, especially, or even from the front with certain poses. And then the erector spinae, the lower back. We'll talk about the ones that are most relevant for hypertrophy, the first 3. So with the trapezius, basically you want to the line of pull that is pulling the barbell away from the body, pulling forward. Right? What this does is it really lights up more than just the upper segment. So with shrugs, right, dumbbell shrug, pretty terrible exercise, to be honest with you. The way a lot of guys do it, it's more of a rotator cuff exercise. They go real heavy with them, high rep with them. They're inefficient. They basically really only work the upper trapezius. They also lack the explosive intent. Okay, that's needed because these are very fast twitch fibers. The trapezius is a fast twitch muscle, which requires an explosive intent. Okay? You want to really work those type 2 muscle fibers. Most, by the way, potential for hypertrophy in those fibers, generally. Now, I should mention, Olympic weightlifters have huge trapeziuses for their size and the amount of hypertrophy work that they do. This is really just a result of explosive intent in the clean and in the snatch, lifting that barbell to the shoulders or to extension of the arms overhead on the floor. It's all about explosive intent, maximal efforts, triples or fewer repetitions. So to work the trapezius, right, you really want to get beyond just the upper fibers that the shrugs work and the rotator cuff that the shrugs work. And to get real recruitment of the middle and lower fibers, obviously the line of pull has to be horizontal, pull away. And I'm actually going to do a YouTube video discussing exercise modifications to show this line of pull. Different ideas, what we've used in our training with my clients throughout the years for modifying this exercise so that it actually works the full trapezius. It's going to take visualization, so I want to do a video and discussion about that, which I will do in real time on YouTube. Explosive intent is a cue. Basically, to get explosive intent, you want to maintain an external rather than an internal focus. You don't want to think about the muscle working per se. What you want to think about is directionality and explosiveness. So you just want to think through the ceiling, right? Like through the ceiling like that. When you lift elbows through the ceiling, shrugs through the ceiling, get it up, explosive intent, external focus rather than internal mind-muscle connection. That's for the trapezius. Now let's move on to the mid-back, the rhomboids. So for the rhomboids, these are worked well by row exercises, any type of row. But you need to flare the elbows during a row to work the rhomboids, the mid-back. Right? Another great mid-back developer is snatch grip deadlifts, heavy snatch grip deadlifts. Yeah. But basically, with rowing, you want to just generally with rowing exercises, think about squeezing the shoulder blades. Internal focus on these, right? So mid-back rows, you want to be squeezing the shoulder blades, controlling the movement, getting a full contraction. It should be fairly aggressive, but you should be maintaining an internal focus, feeling that muscle, feeling those muscles really active. And then for the lats, for the latissimus dorsi, rows, pull downs, pull-ups, right, are huge. For these, the exercise modification is that the elbows remain along the torso. Brush the torso with the elbows. That's the key. So with rows, elbows along the torso. Same with the pull down or the pull up. Okay? And then modifications for the pull up exercise. Biceps emphasized by chin ups versus pull ups, really emphasizing the lats. All right, so that's it, guys. So, like and subscribe. This podcast, I'm going to put this out. I'm going to syndicate it to YouTube now. I'm putting out videos. I've been putting out shorts. So I want you guys to follow, like, subscribe, let people know. And that's it, guys. All right, great talking to you. Have a good one.